Hi, and welcome back to Sisterhood and Surgery, our January webcast today. And happy Mardi Gras that's coming up next month, because I am a true New Orleanian. Today we're going to talk about enhancing your beauty, do's and don'ts. This was a topic that has been brought up as a suggestion, and we thought it'd be a great topic to discuss. Not everybody needs plastic surgery, cosmetic procedures, or wants them, but for the people who do, more information is always better. So today we have Dr. Bonnie Baldwin, who is a plastic surgeon, and Margaret Donovan, who is a nurse practitioner, and they both are heavily involved in cosmetic procedures. And so welcome to our webcast today.
Thank you for inviting us.
And I'll start, and of course Palma, how can I forget, my co-host. I will start with introductions. So Dr. Baldwin, welcome to live in person, was born in Dallas, Texas, and she left for college to attend Duke University. She attended Baylor College of Medicine right here in Houston, at UT Houston for general surgery, which is where I graduated from, and then back to Baylor for plastic surgery residency. She completed a 1-year microsurgery fellowship at MD Anderson and stayed on as faculty for 6 years and was the only female surgeon in the division. This was a very exciting time because it was the early days of free flap surgical procedure, as it became difficult balancing her life with 2 young surgeons and a husband in a heart and vascular group private practice who trained me when I was a 4th-year resident. She left and started her solo plastic surgery practice. Now she still remains in solo practice and have now gotten into elective aesthetic surgery. She finds this very technically challenging and rewarding. She feels like she has made a profound difference in patients' lives, and it is a privilege to use her medical training to help patients feel personally empowered with surgical results that look natural and refreshing. She's a board-certified plastic surgeon and a fellow of the American College of Surgeons. She's active in the American Society of Aesthetic Plastic Surgeons, American Society of Plastic Surgeons, Texas Society of Plastic Surgeons, the Society of Surgical Oncologists, and is a recent president of the Houston Society of Plastic Surgeons. Welcome, Bonnie, to the show.
Thank you, Dr. Lee.
And
I'd like to welcome Margaret Donovan, who's kindly here from Syracuse. And Margaret is a certified family medicine nurse practitioner. Actually, her daughter is my medical student, and she's a terrific student. We enjoyed having her on the vascular service. Margaret received her RN degree from St. Joseph's College of Nursing and Bachelor's of Nursing from SUNY IT, and a master's in family nurse practitioner from SUNY IT. She's originally from Central New York and has practiced there for many years. And after specializing first in pain management for over a decade, she became interested in wellness and different models of healthcare and helping people age gracefully. I can relate to that. She trained and redirected her practice towards aesthetics, anti-aging medicine, and specializing in non-surgical aesthetic procedures. Her goal now is to provide people of all ages solutions to improve their overall skin health and appearance utilizing minimally invasive non-surgical treatments. And as a provider, she strives to help all of her patients feel and look youthful and healthy at any age. Thanks for attending the show.
Thank you.
So I'll start off with our first question. So how did you choose to, I know you said you were at MD Anderson, go from academic to private practice, and what about aesthetic surgery, and how did your practice evolve over time?
When I first left MD Anderson, which we were doing 12, 18-hour free flap surgeries, which were so exciting, but I did have 2 young sons, and my husband, as Linda said, was a heart surgeon, so I just needed some flexibility, and I just couldn't, find the flexibility that I needed, so I went into private practice. And of course, as you can imagine, at the beginning I was doing a lot of breast reconstruction, but more and more people were asking me to do aesthetic surgery. Baylor did have good training in aesthetic surgery, so I did feel comfortable with that, but I came to find that patients who wanted aesthetic surgery, that had something that bothered them on a daily basis that they couldn't correct themselves with diet or exercise, were as happy as like breast cancer reconstruction patients. So I found the same fulfillment, you know, in doing aesthetic surgery.
And I'm sure they were very grateful, like whenever they got the result that they wanted, right? Because it's like they tried so hard to get there,
Yes.
and just needed a little help. So,
you know, in some situations it's even just like life-changing because they have been so unconfident about what's bothering them. And if you can take that off the table for them, they literally just have energy and just feel so much more self-confident in their family, in their profession, in their community life. And one example is someone that I did, you know, a breast and body surgery on, and went on a vacation with her husband. And her husband said, okay, let's go get dressed for the beach. In like 3 minutes, she came back dressed and ready to go. And he said, you've never taken less than 30 minutes to get dressed to go to the beach. He goes, this has changed your life.
yeah, I could see that. And Margaret, what about you?
So I actually, as Dr. Shaw had said, I started off in pain management and had done that for several years, many years. And I was aging. I have young children. I had my youngest daughter at age 51. So I didn't want to look like her grandmother. I wanted to look more like her mother. And I ended up going to a doctor who did bioidentical hormones and was focused on wellness and just what you can do to improve your overall skin and all those kind of things. Met with her many times, started working with her, and spent several years working for her. And then she retired or went on to Florida, and I kind of took her space and started my own practice. So my goal is really to help people of all ages kind of feel good in their own skin and kind of just have a glow, have a health. You know, if you feel good on the inside, I want you to help look as well on the outside and look like yourself, not necessarily look different, but just look like yourself.
Definitely. Palma, what are, you and I were talking about this topic before about, like I want to know, like Botox, like when to start, you know, do you, because I always hear you got to start, well, I mean, I get it done, but apparently, is it true you have to start before you need it, or, and how often?
Right. I don't think that you need to start it until it bothers you.
Okay.
You know, and I think, you know, just like other areas of our body are always trying to heal, our skin is always trying to heal. But I think Botox actually is valid to start in your 20s and 30s. You know, if you have a forehead wrinkle that every time you raise your eyebrows, it's there, you know, that eventually is going to become a static line. So you're trying to prevent static lines. No one needs Botox. It's only if it's something that bothers you. If your crow's feet bother you, if you, especially in men, they'll have very deep folds between their eyebrows, and it starts to bother them. So it's really, it's a muscle relaxant. It lasts 3 to 6 months. In younger patients, it'll last 9 months to a year sometimes.
Oh, wow. Okay.
So I am not a person that says you need to do it every 3 months. You need to do it when it bothers you. But it does, it improves the quality of your skin, and it makes you feel good. It makes you feel like you look more rested. And, you know, like Margaret said, if you look good to yourself when you look in the mirror, it just makes you have a better day.
Yeah, definitely.
Absolutely.
What's your perspective, Margaret, on that?
So again, very much like Dr. Baldwin, I do think that people are looking at Botox and fillers and just aesthetics in general different than they used to. I know several years ago, people would say things like, I don't want to let anybody know that I've had work done or I've had something done. And now the millennials and the Gen Zs and the 20s and 30s, they're all into self-care and saying, yes, I did this for myself. I went in and I did get Botox because I didn't like the 11s starting. And they don't want those wrinkles to form. So they're very much an open about caring for themselves, feeling good about themselves. And so starting in the 20s and 30s is very, very, very normal. But that doesn't mean that if you didn't start in the 20s and 30s that you can't still improve those those looks. Even though they're rhytids there are wrinkles in those areas, there's things that we can do along with the Botox. The Botox will relax the muscles and stop you from continuing using them to make deeper creases. And then there's other options we can do to kind of lessen those creases and things in your face and make your face look healthier. So absolutely, it's all about now making yourself feel better, and just like I said, giving yourself kind of a glow or a healthy look. Everybody's stressed now, no matter what we do. If we're working with people all day, sometimes we wear it on our face. We're busy, and so being able to kind of do these things to prevent that kind of stress look can make a big difference in everybody's life, how people react to you and how you react back. So,
what are the potential side effects of the Botox? It can't be perfect. There's no such thing. Nothing
ever is perfect. Botox can absolutely have side effects. If you have to go to a provider that really is looking at you. Consultation is an absolute. You want to know what you're looking for. You want to look very closely at, your proportions in your face. People's eyes are different. The way they're set are different. So you want to make sure that whoever is providing you that care is being very cautious when they're putting these injections in, because you're using Botox in the frontalis. It'll drop your brows if it's not done correctly. There's always a potential that you could get bruising. There's a potential for ptosis if that medication gets into one of the muscles of the eye. So there are issues where you can have problems with it, but a good provider and caution and going slow is always a good option for most people.
And Dr. Baldwin, so how do you, like someone who's never gotten this before, how do you know you're going to a good provider? Because I've seen in my own practice very terrible complications from a plastic surgeon that just, tied off arteries and veins. So how do you know that you're going to the right person?
I do think, the classic answer is go to a board-certified plastic surgeon, or as Margaret can speak to, a trained aesthetic nurse injector.
Yeah.
Look at their background. Where were they trained? Were they trained at a reputable place?
Mm-hmm.
Are they, and then go and visit the office, and see what you think. Talk to the person. Look at what the other people in their office look like.
Mm-hmm.
I mean, even for something as simple as Botox, I think it makes sense to maybe get a couple of consultations and see what do people think that you need, and try to understand what the philosophy is and what it is that you're trying to accomplish.
Okay. Yeah. So, because there's some providers that may be very pushy, right? Like where they're like, well, you need this and you need that, and like you leave feeling like, oh gosh, like.
Yes.
But I do not see either of you being that way at all. So, why does that happen? I guess. I mean, of course, money, but.
I mean, this sounds a little harsh to say, but I'm going to say it anyway. I think it's financial pressure.
Yeah.
I always tell patients, whether it's for facial injections or for surgery, what bothers you? I am not here to upsell you on anything or to suggest what you need, because the truth is you don't need anything. It's what bothers you. Mm-hmm. So if just the forehead across your, the line across your forehead bothers you, that's the only place I'm going to do Botox. You can come back later and get it at your crow's feet. Mm-hmm. So I think that you have to, really think what it is that you want and what you don't want, and don't get sold into something that is not really what your goal is.
Mm-hmm.
I think it's really important that one of the first things you want to look at is when a patient comes in, you need to ask them what their goals are. And then you need to basically manage their goals so they have the right expectations, because they may have goals that we can't possibly do, or they may have goals that we don't think will actually benefit them. So what we would do would not benefit them. Maybe like Dr. Baldwin might benefit them more. So we really have to know what they want first, and then if someone isn't asking you what your goals are, what you think about your face, what your needs are, that's not a good sign. You want them to you want a real conversation with them, and then once you come to plan. You want to make sure you manage expectations so that they really understand this is what you think you can give them and what will work best for them. But that doesn't mean they have to do it. That's just kind of what you have come to conclusion. That's your conclusion based on what they're asking for and what you think you can do for them. And referrals to other places is completely normal if it's not something you can do for them.
That's great advice. And then before I forget, if the audience has any live questions for our experts today, you can join by web, go to pollev.com and enter DeBakey and respond with your question, or join by text DeBakey to 37607 and text in your message, and we'll get your questions answered. Palma, do you want to move on to the next topic?
So what about fillers? I've been hearing a lot about fillers and fat grafting. Can you talk a little bit about that, or why would you do that, or when would you recommend that?
So I think in late 2007, 2008, that's when these hyaluronic acid fillers came onto the market and have been tested. So hyaluronic acid is actually in our body. It's in the joints, around the eye. So I consider it to be a fairly safe product, and it also is degraded by your body. So, and it's also reversible with an injection of hyaluronidase. But when these, when this product came on the market, we started to realize that facial aging is not only about gravity and loose skin, it's about facial volume. And once you add some volume, it's actually a more youthful look. So within the plastic surgery literature, there's actually been cadaver studies of what are the fat pads in the face. And it can be very anatomic, the injections of the hyaluronic acid. And because it's reversible, I think it's safe. The one thing that is not safe is if you get an intravascular injection, you can get an occlusion, particularly in the ophthalmic artery, and you can get skin necrosis. So it's really, really important, that somebody knows the right technique. The other thing is, and really it's about 2004 that Sidney Coleman started doing fat injections. So fat injections are tricky, and we're learning a lot more about them all the time. And there's probably stem cells in fat. It is a good filler. It's done in the operating room, and it's done with cannulas, and it is not reversible. So it really does need to be done with an aesthetic sense, yes, because you cannot erase it. But fat injections are also done in the breast, like breast cancer patients with implants. Doing a little layer of fat across the top of the implant it's game changing. So there are a lot of benefits of fat, but fillers are reversible, and they're in the office, and they last 9 months to a year, in some cases 2 years. So I think it's a really good rejuvenating product.
And the price difference, would you say?
Yeah.
Are there different kinds of fillers?
There are different kinds of fillers. But they're not cheap. They are like $700 to $1,000 a syringe. Now, I'm usually only doing about 2 syringes, but there are people that are doing 14 syringes.
My gosh,
that's like a liquid facelift. Well, that's a lot of money to spend for a 1-year result. Fat grafting, part of the technique is that the fat cells are revascularized, and they are with you into the future. So it's much more of a long-term result.
Wow, okay. But what does that cost, in terms of?
If I was just doing some fat grafting to the face, now I do not have an OR in my office, so I am taking people, to the operating room. Yeah. So I would say it's probably $4,000 or $5,000.
Okay, but that's forever versus.
It should be, yeah. It gets you to a point in time, because aging continues.
Right, yes.
So when you're 80, you might need more fat grafting. But the fat grafting that's there is somewhat stable if it's done well.
That is, I don't know.
So there is a place for fillers, and as Dr. Baldwin said, and many people come, especially the younger generation, are coming to get their lips done. Often people are trying to kind of get rid of the nasolabial folds or the marionette lines and to help fill that, but you have to be careful not to overfill, because then they will look a little bit abnormal. Now, at least from a med spa perspective, We're looking at other things that can build collagen for people, so things like PRP or microneedling, PDO threads. There is a smooth form of that thread which would provide volume. So any of these things that can actually make your body produce collagen and elastin is also a very good way to kind of fill and provide volume. They're also using some of these fillers as like biostimulators. Something like Radiesse is one of them, and they will kind of feather it into the face, and it helps. Again, it's a way to tell the face to wake up, your body to wake up, and to build its own collagen. And as you're building collagen, that will last. That is something that you keep, unlike the fillers. However, we're aging every day, so coming back once a year or whatever for retreatment is completely normal in those situations too.
We have a question from the audience. What can be done for dark puffy circles under the eyes? Oh gosh, I have that. Dr. Baldwin, do you want to start?
Well, I think moisturizing for the skin is always really important. Very carefully, you can inject filler in underneath the eye area as kind of a camouflage. But sometimes those dark areas have to do with herniated fat, which is a genetic issue, where the fat pads that are actually protecting the globe of the eye herniate through. And at that point, it's really surgery. It's trimming the herniated fat, and then the septum closes. The good news is that that surgery is a forever surgery because it's a genetic predisposition. But there are ways you can kind of camouflage it, and sometimes you need surgery.
So from a med spa perspective, there are procedures that you can do that can help with some of the fat pads under the eyes or the puffiness under the eyes. Dark circles are harder. PRP microneedling is one of the things that we can do. So microneedling, we can actually go directly under the eye, and that's a great way to help with the wrinkles and just give the overall appearance a better appearance. There is a new laser called Opus Plasma, which is a plasma RF laser, and unlike most lasers, we can go directly under the eye with it and over the eye with it with excellent results. It does have a little bit of downtime if we're going to do a very very strong procedure on somebody, so the downtime might be a couple weeks, but they can get results almost as though they've done a blast. And so I can show you some couple examples of that. Second here, sorry, just getting to my eyes there. So this is an Opus procedure. So this again is just a plasma laser procedure. We're using a small device that goes directly under the eye. It produces a radio frequency response, and so we're getting into the dermis, and this is after 2 treatments. So it depends on what you're specifically looking for, but it can make a big difference. I'm going to show you one other picture, just kind of in general. And same thing, these were done with the Opus Plasma. So it depends if you're looking at an age thing or if you have that heavy skin. Those are often surgical, but there's things you can do that are non-surgical if you're interested.
Does that hurt, the laser?
So what they do, we'll numb the area for a good 30 minutes. It will have a slight burning sensation or tingling sensation. I like the Opus a lot because there are lasers and there are procedures that are very painful, especially RF procedures. Opus is not one of them, so people get through this procedure relatively easily. They have a sunburn feeling for a few days. And we use kind of a cooling spray. I give them a recovery kit to take home with them, and they also will have I give them masks to take home to cool. But I've never had anybody need any kind of medication for it other than maybe Tylenol, but they've never asked for it. I've had the procedure done myself about a month or so ago. I did it around the eyes, but I didn't do an extensive thing around the eyes, and it feels like a sunburn. The after effect, you're a little red for a day or two, and again, there's different levels, and we can go really hardcore after something if there's really significant damage, skin damage there, or we can just kind of go at a medium level, and within a couple of days you're not feeling that sunburn feeling at all. Unlike some of the old lasers where you peel for weeks and a lot of downtime, there's very little downtime. I went to work the next day. By the third day, my skin felt a little bit dry and scaly, but there was no significant peeling. I mean, nobody knew I did it, which I loved. And it makes a huge difference for people that don't want that downtime, because the old lasers, you had a lot of downtime and there was pain. One other thing is this procedure, sorry to interrupt, it can be done on all skin tones, which is really important, because a lot of the old lasers, you couldn't go for the darker skin tones. They could have a lot of side effects, and this can be done on almost all skin tones. So it's a great option for people that are looking for that, that easier and lighter look to their face, eyes.
There are tons of questions are coming in. Okay, so one of the questions, speaking of microneedling, is this okay, roughly what is the cost of opus plasma, and is microneedling just a study or a proven treatment?
So they've been doing microneedling for a very long time. They found that even dry microneedling can have an improvement on the skin, because what you're doing is you're producing micro-injury to the skin, almost as though you get a paper cut or something else, an injury to the skin, and your body just naturally wants to heal. So we are making small open channels in your skin with the microneedling. Now, on top of that, we're using PRP or some type of protein-rich serum. When we do that, it just kind of adds a benefit effect, and things happen faster. It produces collagen over 6 to 8 weeks after the procedure. So instead of having again, there's place for fillers, there's place for everything that we do. But for someone who's kind of interested more in a long-term kind of thing, to do the microneedling, you actually build collagen over a period of time, versus the fillers, you lose it over a period of time and you have to start again. So it's a great thing. I forgot the other question. I apologize.
Oh, how much does it cost?
Oh, so microneedling, again, I'm in a more of a rural setting. I'm in central New York, so it's much smaller than like a New York City. It's more like a Rochester, even smaller than that. Running anywhere from $450 to $750 per session. It is a good idea to do them in a series. So what I often recommend is to do a series of 3, about 6 to 8 weeks apart. Sometimes people will alternate them with laser procedures, and then they'll come back once a year, or they'll know, as Dr. Baldwin says, they'll know when they want something more, when they want to come back for more Botox or something. The patients will call you because they'll see it in their skin.
So with respect to neck skin and saggy neck skin, what can we do?
Saggy neck.
Or even surgically? I mean, what's the best way to manage that?
Well, Margaret can kind of speak, because I do think you can do micropin, to the neck as well. Anything to build collagen and stimulate and moisturize the skin is going to be helpful, whether or not you have surgery or not. And you can even do some, injections of fillers kind of in the horizontal lines to the neck. But sometimes there is a point at which you have like a turkey gobbler neck, or you just have loose skin. Mm-hmm. And at that point, really, it can be surgery. It can make such a big difference. There is downtime. There's no doubt about it. And it is a surgical procedure. But what I find is if people are bothered by it enough and they've tried some non-invasive things, they're fine with moving forward with surgery, mm-hmm. as long as they're a healthy person and they're a good surgical candidate. Mm-hmm. But in the neck, you have anatomically the platysma muscle, which can loosen like a hammock, and it can also divide in the middle. So a neck lift, you're actually tightening the hammock. So you tighten the hammock in the midline by a submental incision under the chin, and tighten the hammock back in the postauricular area, and the skin will actually redrape. And you can do that with or without a facelift. So it just depends on how advanced the changes are that you're trying to address.
So non-surgically, for saggy skin around the neck area or face, we often use PDO threads. The Opus laser is wonderful for that as well, because the RF, the radio frequency portion of the laser, actually gets to the nervous and kind of remodels that area, and it will cause skin tightening and lifting. So it's a great way to do it. I'll give you some pictures of the neck area. So PDO threads are polydioxanone threads. They are sutures that are dissolvable that they've used for surgeries for a very long time. They're relatively safe. A trained provider can provide excellent benefit for you without doing a surgery. So this is an example of the before and after for PDO. So using sutures, there are two different types of PDO sutures. There's ones that are barbed. The barbs are lifting sutures. There's smooth ones. Those usually provide volume, and they also help you build collagen in certain areas. So if you're having hollowing in the cheek areas or something, we can put those in a mesh, and then you actually build collagen without having filler. So it's another way to do it. Some people use the term solid filler when they use the smooth threads, but these are lifting threads in these things, and they use cannulas. So they go in by cannula. So they do an entry point. You are numb throughout the procedure. It's relatively comfortable. If there's any discomfort, they'd add more lidocaine. And the lifting procedures, there'll be one point of entry usually, and they can put several threads in on each side. They can do it in the neck area. They do it to lift breasts. They do it to lift buttocks. They can do it just about anywhere, depending on what the person is looking for. Now, this person has more skin there. There are people that have heaviness to their face, and they will use stronger threads. Some are not candidates if they have. So in this situation, this person is, she has some damage to her neck and things, but you can see the jowling is better. The area around the neck is improved, and that's with PDO threads, lifting PDO threads. And as an aside, I was with a colleague this weekend. She put about 3 or 4 threads in my face on each side, 3 threads on each side. So I have them. I have some swelling. I have a small area where I'm bruised. So my face is swollen right now, but it doesn't hurt. I'm working. I'm doing everything. So there's not a ton of downtime. There's always risk with these procedures. It's invasive like anything else from a standpoint. You're talking about nerves and in your face, and so you could get dimpling. That's one of the biggest complaints about the procedures, as some people will say that their skin is dimpled with the barbed threads. The dimpling resolves. It'll resolve in a few weeks, but you just have to encourage your patients that will recover. You'll be fine. If there is a situation where something's pressing on a nerve or something, there are rare situations where these that can be removed, but in general, we can reposition. We can lift the barb off, or the skin off the barb, or the area off the barb, so there's not a lot of discomfort. And people do very well. They're happy with it because they can't afford surgery, or they just can't afford the downtime, or for whatever reason, they just prefer to have a non-surgical way to kind of improve this. So you can just say it's just an idea.
What's the cost for that, Margaret?
So, it definitely is different in different markets. Some providers will just do it by face. They'll say, $2,500 for a neck, or $25 for a mid-face. Some will say, $4,500 if you want to do both. The threads, obviously the providers purchase the threads individually, so they can choose however they want to do it. But in general, you're looking around about $2,500 per area, and then if you're doing both areas, they will give you discounts on it. And then threads can also improve lips, so you can put some threads in to improve the look of your lips. If you're not a filler person, you don't want to take the chance with filler. They do eyebrow lifts. So this is a younger person who decided she wanted that cat eye, and you can see she's lifted the brow on the very end without Botox, and these are just a couple small threads that go in. There may be some bruising. It won't last for very long. There's usually very little discomfort, and unfortunately, there's a lot of people out there doing this kind of thing. You also can lift issues if someone has kind of a lot of people have dissimilar eyebrows, or one eyebrow is up and they want to fix that, so you can do one side, and so they can be very versatile, which is a great thing to have for aesthetics.
And how long does this last, Margaret, the threads?
So the PDO threads, they will go in, they'll last between 3 to 6 months. Your body breaks them down because they are dissolvable, but as they're breaking down, you're building collagen and elastin around that area. So even though the threads are gone, you've actually tightened that skin and actually improved that tightness and benefiting the laxity, so you're not getting so much laxity in that area wherever it is. They last about a year, sometimes longer. What we usually say is if you're going to get like a lift like that where you're using the barbed threads, we'd like you to come back once a year, just for a touch-up if you need it. You may not need it. You may be fine with the way you are, but it's something that if you're, especially if your skin is heavy, you have a lot of thick skin and it's heavy, they may need a repeat after a year. But in general, people would prefer that. And again, when you're looking at fillers that are $750 or $800 a vial versus just kind of pulling everything up, you're losing that jowl. You're not having to put, a lot of people will put fillers in to kind of balance out the jowl. So here's a situation here. So this lady, this person had, you can see the jowl. She has marionette lines, nasolabial folds, and she had a couple of threads placed, and it's improved it significantly. And that's not with any filler. That's just with pullback of the threads.
So we have a bunch more questions. Dr. Baldwin, did you have a comment before we?
It'll be interesting because as people get used to the result that they get with the PDOs, I wonder, if they'll be almost more open to surgery, because they like what they see, but
Right.
there's a point where cost efficiency, it's almost better to have surgery.
Mm-hmm.
Right. Well, the other thing is we're aging every day, no matter what we do with aesthetics, we're still aging, and so there will come a time when they may say exactly that. It's time to do something more specific for the areas that are lax or the skin. And this doesn't really, it can't take away that saggy skin. That skin goes somewhere. So when we do the PDO lift, it's going to go up. But if you have significant jowling there or significant chin, sometimes the surgery is a better answer for you. And that's the benefit of getting that consultation and really looking at the patient and saying, what are your goals? Is that little lift that you just saw with that last patient, was she content and happy? Absolutely. Mm-hmm. But if she wasn't, then she may be a better option, or Dr. Baldwin may be the best option for her.
So another question, is it required to make sure someone's mental health is good before physically changing them?
I think it's a very interesting question. I think just what you were saying, Margaret, it's all about realistic expectations. If someone comes in and they think even non-invasive things or surgery are going to help them find a new husband, well, that is a red flag. So one of the great things about experience, and I'm sure in everyone's practice, is that you kind of figure out who are the patients that are actually going to benefit from what you have to offer versus being disappointed or frankly angry at you. So I don't think at the very early beginning stages of aesthetic surgery, there was a feeling that you should have a psychiatrist examine you before you have aesthetic surgery. But I don't think that's true anymore because people feel like this is just part of self-care and maintenance, and because things are so much safer than they used to be.
And society has changed with that too. The younger generation really believes that, I want to, you can use the PDO threads to lift a nose or to, change the shape of the nose, change kind of a bulge in here, or things like that. So they're more used to changing their appearance than we were as we grew older. But I agree, it's the most important thing is to have a relationship with the patient so that that they know what you can give them and that their expectations are realistic. And I will turn down patients that I don't think I can help for that reason, or if I get that red flag, I would refer them to someone that I think that would give them that option if they're looking for something more than I can give them, because it's never worth it. They won't be happy, and they will continue to want something more from you that you can't give. So it is important.
Would training our facial muscles be beneficial to our fat pads on our face?
It's an interesting question. I'll give my 2 cents worth, and then we'll see what Margaret has to say. I mean, there are things which are kind of like electronic stimulators called like NuFace. There's a new application of like a pad that basically contracts the facial muscles, and they're working with that.
Like a pad, like you put it on your face?
You put it on your face and it stimulates it, and I guess it's tightening the muscles, so it's doing like facial muscle exercises. Oh. So I'm just not sure where that's going to go in the long term. You know, I'm curious to see what Margaret thinks. I mean, here we're doing Botox to relax things, and now here we're stimulating the muscles.
Yeah.
But I mean, there's probably some truth to it, or else the industry wouldn't have gone in that direction. So we'll see. You know, I think there's something to be said for waiting 3 to 4 years to see if a technology is actually, not only is it going to help, but is it not going to hurt? You know, you don't want it to be harmful.
Yeah.
What do you think, Margaret?
So there are definitely those stimulators out there that will kind of lift a brow temporarily. So it will give you some kind of benefit for the day. And so people love them because they get that refreshed look. Their eye gets more open. They can tighten the jaw a little bit, and it will tighten the muscle. I don't know if it has any permanent effect. I mean, because people are still coming to my practice and coming to Dr. Baldwin and other people like us. But I think it does. There is a place for it. It just like anything else, like cutting your hair or anything else, that people are using it to feel better and to get the results that I want. I've seen people use it when they've had, again, differences in brows and things, and they can use this to lift up their brow temporarily or do something like that. So there is a place for it. They are using it. A lot of estheticians will use those types of stimulators along with IPL and different things too to give that type of lift temporarily. So, and they will have you come once a week to do it. And I don't think it's permanent, but it does change the look for a period of time.
Do facial creams actually do anything?
I think moisturizing the skin is incredibly important. And I do think that there are some cosmeceuticals. I mean, if nothing else comes out of this, I mean, like we talked about, our skin is trying to always heal and improve itself. Things like washing your face every night, no matter how tired you are, and probably in the morning. Things that are proven are vitamin C serums actually do help prevent oxidative damage and collagen breakdown. So vitamin C serums work. Retinol at night does help with skin turnover, so those are great. And I think keeping your skin moist makes a huge difference. I mean, I don't know, even breast, body incisions, when the patient will actually keep them moist, their scars are definitely better and they definitely heal better. So I do think moisturizers help.
Well, like the Korean skin, you know, it's like 8 steps or whatever, but their skin looks like, you know, I mean, just like there's like not a wrinkle, but I've read about it, and it would take Palma like an hour in the morning and an hour in the evening. Have you heard of this?
No, but that would cut into my beach body time, and that's I do my beach body. Forget it.
Yeah, but it's like a 7-step process that you do in the morning and the evening.
I'm sure that it's worked. It's just that, you know, you have to kind of choose how you're going to spend your time. But some skincare and moisturizing, I think absolutely is worth the time and the money.
Yeah.
Margaret? What about age spots, like dark age spots or sun damage to the skin? Like, how do you get rid of them? Just a cream or laser, or what's the best? Yeah,
Margaret, do you have an IPL or?
So both, both. Laser does really well, and then there are creams that you can put on, or cosmeceuticals that you can put on to whiten as well. So a combination of the two can work very well. If you really have a lot of damage, again, lasers by far will make a huge difference in those. And lasers can be targeted for specific areas, or it could be a general thing. You know, people that don't want freckling of their face, or they have a lot of sun damage, they have acne scars. Any kind of targeting thing can work. Lasers can work really well as well.
And then let's not forget sunscreen.
Oh, yeah.
I mean, every day. I don't care if you're in the operating room all day. I mean, you just have to wear sunscreen every day. And then little things like, you know, alpha hydroxy, you know, lotions, glycolic lotions, they help the skin turnover, which is part of what, you know, the pigmentary changes are. So some of those over-the-counter things at Sephora or Ultra, they help.
So, okay. And so what product lines do you like or prefer?
Well, the ones that are cosmeceuticals, those are usually sold through med spas or for, you know, physicians' offices. SkinCeuticals is one of the early ones. Obagi, you had mentioned that, Palma. You know, that is excellent skincare.
It works.
The other one.
Why is La Mer so expensive?
I'm not sure.
Okay.
Because they can get away with it.
Like, it's great. Like, I mean, I don't understand. I mean, it's like $200. I mean, I don't use it, but I mean, I see the prices. I'm like, $200 for a tiny little.
I know. I think some of those at the department store, like La Prairie, they're not cosmeceutical grade. They definitely cost a lot. I'm not sure they're worth it.
Okay. Good to know.
In my opinion. What do you think, Margaret?
So I agree. So the problem with a lot of the cosmeceuticals is that patients have limited budgets, and so we try to work our best through that. But I agree, a good skincare line, a good cleanser, a good toner, so that they are keeping their skin clean, and something that is going to do just kind of take off the dead skin at least weekly. You know, there are estheticians in a lot of places do microdermabrasion, which is also a good way to kind of just take it off. It's something you wouldn't do regularly. There are home units that you can do as well. Anything that will turn over the skin is a good thing. And then also just, you know, supplementing with good vitamins too for your skin. You know, just making sure that you're getting a good healthy diet, and vitamins will make a difference in skincare as well, and your hair and nails, kind of thing.
Okay.
So what about hydrofacials? Somebody asked me about hydrofacials. Is that a thing?
Oh God,
yes.
it's amazing.
Yes.
I've done it myself.
Did it. Margaret probably knows better than I do.
Yeah.
I
noticed.
Dr. Lee knows.
Yeah. I mean, I noticed a difference. You know, with it, it's better than a regular facial.
Right. So it's a medical grade facial. And it can target specific areas that you need. So someone who has issues with acne or issues with, you know, obviously aging sunspots. So it will basically really do that form of it does do a microdermabrasion with the hydrofacial, but then it will add specific ingredients or serums that will actually improve the overall line of your skin too, and healing specific issues. So if you have rosacea, if you do have acne, if you have any kind of scarring or anything like that, hydrofacials can also improve that. The most important thing is having a regimen. I think that's what really is. I think we all get so busy we forget we should do something with our skin, and it doesn't have to be that big. It just has to be consistent. And so doing a hydrofacial every few months is not a bad idea, or some type of facial that will get rid of that dead skin. Peels can also, the chemical peels, you have to be careful because you have to make sure that your skin is not one that's going to react if you have very sensitive skin. But there are peels that are very gentle for your skin as well. As long as you can get that skin to turn over, you can get the dead skin to come off, and you can get new skin forming, and then you're just hydrating as much as possible. If you have oily skin, hydrofacials are very, very good for that as well, because it targets that in the same way. They also do forms of IPL and red light and blue light therapy for specific things while they do the hydrofacials, and so it's definitely a grade above the regular esthetician kind of facial, and even if you do it every few months, it's worth it.
Okay, we are getting down to 5:50, so we've but the questions keep coming in. So, is there a point where lasers or other treatment won't work with lines or spots? I mean, Dr. Baldwin, I'm assuming like that's
Yes, probably. Sometimes, especially if people start late, which is kind of why the discussion is start early in skincare. People that literally have leathery skin that is so damaged, you can do a beautiful facelift on them, but they're not going to have as good of a long-term result because the quality of their skin. They're more aggressive, like 5FU kind of treatments that dermatologists will do for skincare, but are very deep lasers, Fraxels. Or deep peels. Historically there's been phenol peels, but you're red for weeks. So there are very aggressive treatments that can be done. But there are some people that are really, it's just difficult. They started kind of late, and there's going to be limits to what their results are going to be. Doesn't mean you don't try.
Yeah.
Right. And so a lot of it depends on what their tolerance level is and what they want to accomplish. If they're really able, they don't care that they're going to be down for a month, that they're going to have discomfort, they're going to peel, then the ablative lasers can be very beneficial. The Opus is an ablative laser. It can be an ablative laser, but it doesn't have the same downtime because we can regulate it. So, someone who's 80-something years old, who's never done anything with their skin, is going to be much harder to deal with someone who's in her 60s even, that has some issues. She would probably get a much better result. So it depends on where they're at with their skin and what they're willing to do to keep it at the level that they need to so it stays, it's maintained.
Palma,
I have a question.
Yeah.
I have a question. So with respect to after you have children, you have extra skin. And some people I know have had tummy tucks.
Yes.
A gynecologist told me that you'd rue the day that you did that, because later then you just have like prune belly syndrome looking skin later. And I don't know if cool sculpting is a better option. I mean,
so I actually do cool sculpting in my practice. Cool sculpting actually goes after the fat, the adipose tissue itself, the fat cells. It doesn't have an indication that it's going to reduce laxity in your skin. However, in most cases, unless we're talking somebody who has really loose skin, the skin tends to bounce back. And every treatment, you reduce your adipose tissue, your adipose cells about 20%. So it depends on what you're trying to do. If you have pockets of fat that you're just trying to get rid of because you can't do it with exercise and things, cool sculpting works great. It can contour, it can take away those little areas that we can't get as we age, things like that. If it's something where it's really hanging skin, someone who's lost a lot of weight or something like that, then cool sculpting you would not be a candidate for cool sculpting. And cool sculpting can be done on the arms, the belly. There is an indication for the chin, double chin, inner thighs, outer thighs. It has a lot of indications, but there's limits to what it will do. It really goes after just the adipose cells themselves. It kills the fat cells, about 20% of them, wherever the applicator is placed.
Because a lot of the change, for some people, although some people do very well during pregnancy, part of the changes are loose skin. And really, loose skin is treated with surgery. And also, with pregnancy on the abdomen, you can also have separation of the rectus muscles where you have stretching, of the fascia between the muscles. I mean, a tummy tuck is an incredibly powerful operation. You're imbricating the muscles back together, which is your layer of strength. You're removing all the extra skin from the umbilicus to the pubis. People are just trying to get back to where they were before their pregnancies. And, sometimes that's the only way to do it. And that also helps cut out some of the stretch marks. And then often it's done with breast surgery at the same time. Maybe you lost all the volume in your breast, and so you'll have a breast augmentation, or you have a lot of laxity and loose skin in your breast. So a mommy makeover is usually breast and body work after pregnancy. Breast lift, breast reduction, tummy tuck, mini tummy tuck. And then cool sculpt is great, but I must say liposuction is very specific and very effective, because you're using a cannula under the skin. You can absolutely get out as much fat as you need to get the contour that you're looking for. And as long as your weight stays stable, it's a forever result.
Cool sculpting also, when you do it, the area that you do cool sculpt, those fat cells will not come back, but it's limited to the area that we actually put the applicators on. The nice part with cool sculpting, for some people, they do not want to do surgery. They don't have a lot of options if they can't do surgery. And it's great for contouring. So people they're not necessarily heavy, but they have areas or pockets that just don't want to go away. Cool sculpting works great for that. It also can debulk things too. So if you have kind of a bigger belly area that you want to kind of debulk, cool sculpting can work for that as well. And it's non-surgical. So a lot of it depends on what the patient wants to do, how much downtime they can manage, their budgets, all those things matter. And again, it's a conversation with the patient.
Okay, last question, Palma, right? Probably.
Yeah.
Okay.
Wrapping it up.
Yeah. What can you do to minimize scarring after a procedure?
It's a great question because that's a trade-off of surgically removing extra skin. A lot of plastic surgery is about camouflaging scars in contours. So in the face, you know, it's behind the ear, it's behind the tragus of the ear, up into the hairline. In the breast, it's a scar around the areola. Keeping scars moist, you know, not getting too hot, too swollen at the beginning. And then those are the things that help minimize scars. There's also silicone tapes that help with scars, and there's also some lasers that will help with scars. But usually if you do the surgery without tension, because the more tension that you have, the more, you know, thick the scars are, and placed in a very cosmetically safe location, the scars are a trade-off for sure, but they're usually something that the patient does not complain about.
Wow. Well, this is like the most questions we've ever gotten.
Yeah, this is we covered a lot of ground today,
Yeah.
and you guys were amazing. The way you came from 2 different angles is awesome.
Yeah.
Thank you. It was fun.
Thank you.
Very
for
lucky to
this.
have you on the show. Thank you so much.
So the same. If anybody has other questions, if you share my email, I'd be happy to send it on or answer them if you like.
Yes. Can we? We'll have the studio because one of the questions was contact info, so we can send that out on like the YouTube.
Please.
Yeah, contact info. If anybody wants a consultation. Obviously, Dr. Baldwin's in Houston,
Right.
and Margaret, you're in New York, so location specific. But yes, we will definitely do that. And but I appreciate, Palma and I appreciate this a lot. We love doing all various different kinds of topics, and everything is really truly about self-care, whether it be academic, your mind, your physical health, your face, yeah, exactly. So we really appreciate it, and our audience appreciates it. So thank you very much.
Thank you for inviting us.
Thank you. It was my pleasure. I loved it.
So much.
Thank you so much.
Yes.
Thank you again. Nice to meet you, Dr. Baldwin. Thank you.
Bye.
Bye-bye. Thank you, Dr.
Good night.
Bye, Dr. Shaw.